Coronavirus is not just changing everyday life, it's also changing how many Triad hospitals are operating, including Cone Health. So in today's To Your Wellbeing, we are breaking down everything that you need to know. Cone Health's Chief Operating Officer, Dr. Jo Cagle, is joining us now. And first, let's start with some concerning numbers that she just brought to our attention.
Good evening. Yes. We've been watching our numbers very carefully of the number of patients we're admitting, and what we've seen over the past 5 to 6 days is that the number of patients that we are admitting who test positive for the coronavirus have been increasing. So for the month of April, our numbers were staying flat, around 18 to 20 patients, and then last week, about Wednesday, those numbers began to increase and have increased daily since Wednesday. So while they are still certainly at a level that we can manage and are managing very easily at this time, we are seeing those numbers to be on the increase.
Okay, and to follow up with that, I'm understanding that today is the highest one-day total of COVID-19 patients at Cone Health?
Yes, it is the highest one-day total that we've seen since the crisis began.
And so you were saying that you were seeing 18 to 19 patients that were testing positive in 1 week?
No, so our total number in the hospital would be 18 to 20 per day in the hospital. And then beginning last week, those numbers began to increase. And each day there would be more and more. And now we're in the mid-30s of total number of corona positive patients in the hospital.
Gotcha. Okay, so it went from 18 to 19 a day to 30 in the hospital a day. And so we just want to make sure that we clarified that so everybody at home got that as well. The highest one-day total just recently. So follow-up question there. So why do we think this is happening? Do we feel that these numbers are going to continue to rise, like tomorrow we're going to see another, topping total?
So we do believe the numbers will continue to rise. Our internal modeling and information would say that we've not reached our peak yet, and so that we would expect the numbers to continue to rise. We really think that social distancing is still very important for us to follow, and that's hard to say when you have beautiful days with the sun shining, spring is here, and those around us in neighboring states are starting to open the beaches. And yet we are seeing our numbers still rise because we don't believe, at least in this region of the state, that we have peaked out yet. There are still infections that are occurring. So we do believe that social distancing is still very important.
And I guess the follow-up question to that would be, when you see those numbers rise, is it all ages across the board, or are we seeing a majority of a certain age?
So we're seeing the disease in all ages, and the majority is in our elderly population, who are certainly the most vulnerable. But they're not the only age that we're seeing this disease in.
Okay, and people are often saying, well, I don't need to social distance, or I don't need to wear a mask because I'm not worried about getting it. But is this something where, because I'm hearing you say it's in the elderly population, that we should be worried about who we might be giving it to?
That is absolutely correct, Stacey. Everyone needs to be wearing a mask when you go out. You need to continue to be 6 feet apart and stay home when you can. So you might be young and healthy and less likely to have symptoms from the disease, but you may have the virus and have no symptoms and have no idea who you might be giving it to. So we all need to practice social distancing to protect others who may be more vulnerable.
And I know you had said a little bit about this, about how you don't think that we've reached our peak yet, but based on the number of hospitalizations, someone's texting and asking, do you have a thought of when the peak might happen?
So our peak could happen as late as mid-June. Because we flattened the curve, it's going to rise much more slowly. And our numbers are actually showing that our peak could occur in late May to mid-June.
Late May to mid-June, and I just have to kind of let that sink in just for a little bit, because I think we were all thinking it was hopefully going to be by late April or early May.
Well, you know what? I would just love to be wrong, but our numbers are not showing us that. Our numbers are really consistently showing us late May to mid-June.
Okay, this is good to know. This is all good to know, so that we're dealing with facts and not with rumors and not with fear of what we think could happen or may happen, but what we are seeing right now.